Welcome back. Now it's time to take a look at some health headlines on MedWatch today. A new study shows that to achieve your weight loss goals, be consistent. Slowly shedding pounds can be better long-term than a drastic drop in weight early on. Researchers put 183 overweight or obese people on a weight loss program for a year. Every week, weight was tracked and analyzed. Researchers found that people who quickly lost weight in the beginning of the program struggled to keep the weight off. But those people who slowly lost weight and made sustainable changes to their lifestyle were able to keep the pounds off after a year. And an alarming trend: babies might not always be sleeping the safest. A new U.S. study found that less than half of U.S. mothers consistently put their babies down to sleep on their backs, which is the safest sleep position for infants. A little over 77% say they usually do, but not always. The Safe to Sleep campaign has been telling the public since 1994 that babies should sleep on their backs to reduce the risk of sudden infant death syndrome, strangulation, or suffocation. Plus, you don't have to be a germaphobe to be concerned about food safety. Researchers set out to see how safe some of our food habits are. Urban legend says you can eat food dropped on the floor if you pick it up in under 5 seconds. The study found, however, that there's no safe amount of time for food to be left on the floor. Also, be on the lookout for double dippers. The study found high levels of mouth bacteria in dips. Experts say always be aware of how you and the people around you handle the food you eat. Every week, we honor an employee at community medical centers, someone who's there to hold a hand, help someone in need, while always having a smile on their face, someone who makes a difference within community. This week, we meet Jane Poindexter. Jane is a respiratory therapist at Clovis Community Medical Center, a profession she's excelled at for 35 years. Jane helps patients who are having trouble breathing, helping people on ventilators and with breathing treatments. And she's needed everywhere in the hospital, from the ICU to the delivery room. A mom of 4 kids, Jane is a natural caregiver who always treats her patients as if they were her own family. She's known for picking up extra shifts over the holidays and when her coworkers are out sick. And she does it all with a positive attitude, even when the days are hard.
I don't know, you got to be compassionate. You got to love what you do and love people in all forms. It's not always nice. You got to be able to do the good, the bad, and the ugly.
Jane says her job is rewarding as she loves interacting with her patients and seeing them get better. She's also known for having a good sense of humor and always tries to get a smile from everyone she treats. If you'd like to join the team at Community, there are openings right now. Our job of the week is for a full-time ICU clinical nurse to work the night shift at Clovis Community Medical Center. Responsibilities include delivering patient care and the evaluation of patient needs with the highest professional standard. Qualifications include being a graduate of an approved nursing program along with a California RN license with a current BLS and ACLS certification. For a full job description and additional information, just head over to the website jobs.communitymedical.org. Coming up on MedWatch today: why it's never too early to start talking to your family about your end-of-life wishes. Still to come, we learn about advanced care planning and why you should get started even when you're healthy. Don't miss these important details. And making your kids' lunches with lots of love and lots of different colors can make all the difference. We get tips on how to make sure your kids' lunch always packs a punch. That's next.